I'm Aneel Paulus. I'm a physician scientist. Spent many years at the Mayo Clinic overseeing and running a drug development laboratory focusing on immunotherapies, primarily for blood cancers. Conventional therapies, I would say, if you're going to look at chemotherapies and even some of the small molecule approaches that we had developed over the last decade, they've been transformational. But I think the major revolution now has come in the form of immunotherapies. My lab and I spent many years developing some of those for leukemia patients, lymphoma patients, and what we realized is that very early on that the immune system gets completely deranged when the cancer starts kind of taking root. And so if you're able to, first of all, recognize the level of dysfunction and then develop strategies around that to either repair part of the immune system or re-educate it, provide it some memory, be able to enhance it in some way, that is your best shot at really beating this thing fast. NK cells are unique in many ways, but maybe three ways that I can highlight how they differ from some of the treatments that are already in the market, checkpoint inhibitors, other kinds of immunotherapy that primarily work through engaging the T cells. T cells get all the press, but the NK cells are complementary to the T cell activity. So they're not, one doesn't replace the other, but they work in tandem in a human being. NK cells have the unique ability to recognize self versus non-self through mechanisms that are different, and you know what? They don't need to necessarily know the way a T cell does that, hey, this is cancer and it has this unique flag or marker, protein marker on the cell surface. And if it doesn't have that, the T cell is like, well, I don't really know what this is, I'm not going to attack it. The NK cell is like, wait a second, this is not self. This you need to go and attack. And so they're exquisitely able to go and home in and just target these cells, these cancer cells, and kill them off. And a variety other number of cells that are infected by viruses or fungi or any other non-self system. So that's one thing. The other thing I'd say that NK cells are really adept at is their efficiency. So it takes less NK cells to kill more tumor cells than it does for T cells. So I don't know what the numbers are, but it's just less of NK, more of tumor that they can kill. And it doesn't require, the third thing I'd say, the level of education, training that it requires for you to get a T cell to do what an NK cell does, way less. They're a lot smarter in many ways than a T cell is. So I'd say those are unique. I got introduced to NKore. I got to really learn about their science. I was impressed with their science. That's the first and foremost thing. And then I was able to understand that, how are they going to be able to translate that science to humans. There's a big gap between laboratory to mice to men. It's not the same. But we've been pretty good at figuring out, like, hey, what works and what doesn't. And so I was excited to follow along on this part of the journey. The process to isolate out the NK cells is pretty standard. Some people do it just a little bit differently in terms of separating it from the PBMCs. But afterwards, what NKore is able to do, that's pretty new. The way that they expand out the NK cells, that's not being done by anybody else. The NK cell world is kind of having its moment right now. It's a game changer. It's not anything like what we've seen before in the cellular therapy realm. And I say that with a lot of caution, in the sense that we don't know a lot, actually. But we're starting to see early signs of its ability to overcome a lot of the challenges that T-cell therapy has had. T-cell therapy has had a lot of time in development. It's the one that's in the clinic with the CAR T-cells and other adoptive T-cell therapies. NK cells are just by virtue of the way that the cells are, they're able to overcome a lot of those limitations. I think people, my colleagues, my compatriots, like they're excited. But I think it's that cautious optimism to see exactly, well, let's see how far this can go. And the excitement, I think, is going to be moreover with, what do we pair this with? Typically, combination strategies are the ones that have yielded the highest results in terms of lasting remission in patients. It's not typically a single therapy. So I think that's where we are right now with NK cells, is that, great, this works. Does it work better alone? Or if it's going to work even better with a combination of some sort, what do we pair it with? One of the other indications that NK cells are being explored in is in autoimmune disorders. cancer and autoimmune disorders are kind of like the Janus coin. They're related in some ways, and a lot of patients actually who have cancer have some underlying autoimmune disorder. So that's an exciting area where NK cells can be deployed. The other is in the aging process. As we get older and older, we accumulate what are called senescent cells, and senescent cells are notoriously difficult to eradicate. They're essentially zombie cells where they're supposed to die, but they don't die, and they just sit there and secrete a bunch of proteins and other things that are just bad for health. So if you can deploy a strategy essentially using the NK cells, which are some data, to clear those out. That's pretty exciting in terms of, again, the aging process in which cancer is actually linked to. 5 years from now, I see NK cells as being used in a variety of different conditions. They're going to be used even before somebody probably develops cancer, where we're able to detect at a much earlier stage where it's a pre-malignant condition of some sort. And we're able to actually use NK cells for that individual to help build their immunity back up and restore the normal functions of their immune system to combat cancer and any other disease. Cellular therapies are here to stay. I think we just kind of figured out a wide variety of ways to actually make them tangible products that you can give to human beings and then understand the effects of those things. I like to think, and I have hope, that the NK cell therapies will work equally, if not better, at some of the solid tumor treatments that, brain cancer and so forth, that other people have. 10 years ago, we wouldn't have necessarily even imagined the kind of cellular therapies and the approaches we have to modify NK cells or T cells, any other variety of cells nowadays, and then put them back into someone. So I think that, the future in terms of cellular therapies is better understanding of, what makes these cells go haywire a little bit? How does a cancer cell manipulate them first? And then what kind of re-education, training, and memory you need to infuse these T cells or NK cells or the immunotherapies, that they retain the information to remember, this is a cancer cell, this is not. And does this cancer cell change its disguise in a variety of different ways? Can it cloak itself? And what does it look like if it's uncloaked? And then just go after that and retain that memory. So it's continuously fighting in the background where you're not even thinking about it. It's just, you give a shot, or maybe 2 in a year. That's the goal. And then the system's put on autopilot where it does exactly what it was always designed to do, which is keep cancer at bay, keep infections at bay, and you just go and live your life. Future cancer therapy is going to be multimodal, and it's going to be holistic. It's going to be mind-body connection. It's going to be ways to kind of tap into your own, I'd say, God-given ability to heal. Right? We are not designed as human beings to be taking pills every day. Chemo is great to achieve really quick control over fast-growing cancers, but we've evolved out of that. It'll have its place down the road, but I think the future of cancer therapy is all immune system modulation, to really make sure your immune system, from the beginning, never loses its vigor, its strength, so to say. And a lot of that starts with believing that, and adopting healthy lifestyle patterns. Prevention is the key thing. I would say that if there's one thing I would say is cancer therapy will increasingly become more preventative rather than therapeutic, where it's like, you have cancer, now what are we going to do? Versus in the future, it's going to be like, well, let's prevent you from having cancer, and engaging your immune system, lining that up, and protecting its ability to recognize cancer in all of its millions of forms that it takes in the body is going to be the future.